Welcome back. You're watching Newslink here on eNCA. Well, the acting Minister of Health has confirmed this morning that the country's past the peak of its third COVID-19 wave. Mamaloka Kubai held a media briefing on government's response to the coronavirus pandemic, and our reporter Heidi Giokos has been tracking the story. She joins us now from Johannesburg. Heidi, thank you for joining us. Bad news, the violence forced a number of vaccine sites to halt operations in both Gauteng and KZN.
Yes, certainly, Annika, and I think this is a huge concern because we understand that 47,500 vaccines were destroyed, looted, demolished because of the looting and unrest the country went through last week. This is a huge concern. This means over 47,000 people that could have gotten the jab cannot get that jab because those vaccines have been destroyed. We do understand that about 120,000 pharmacies have also been looted and destroyed because of what happened in KZN and Gauteng. We do know, however, Annika, that the acting health minister is saying that a large number of those that have been arrested due to the looting and the unrest actually tested positive for COVID-19. There was a huge concern that there would be a spike of infections, especially in KwaZulu-Natal, because of what was going on and the gathering and confined spaces that many people were in because of the looting. And we do understand that the acting health minister is saying that it's imperative for those that were in any way subjected to that environment need to get to the nearest testing station to make sure that they protect not only themselves but also their families. We're not seeing much of a spike in infections in KwaZulu-Natal as many people expected, but we do know that there's an issue around testing and many facilities trying to get back online because of the disruptions and the unrest that happened over the last week.
So despite the increase in those found positive who were involved allegedly in the looting, we are passing through and going down in numbers in terms of the third wave.
Yes, so according to the acting health minister, she says that we are over the peak of the third wave, which is fantastic news given the fact that many experts were saying that other provinces were going to experience what Gauteng experienced with a very high infection rates and very large numbers of positive COVID-19 cases. But we're seeing that overall cases are dropping. That's, however, the acting health minister saying that we should not let our guards down. And if ever time, it is now for us to be extremely cautious. And the numbers are still fluctuating, Annika, and I think it's important that we highlight this because yesterday it was about 14,000 cases, the day before it was about 16,000, and it's all related to how many tests are done per day and the positivity rates that, of course, government will be looking at when it comes to easing of restrictions. The numbers we are experiencing, we've never experienced before. So the acting health minister saying, as much as the numbers are coming down and things are looking slightly better, we still need to keep our guards down and make sure we stick to the rules and regulations.
And we do know, of course, that while the vaccine is fantastic in making sure that you don't get desperately ill and possibly die from the Delta virus or whatever strain is going around, it doesn't stop the transmittal of the virus or the transmission of the virus. So those masks are really important. Heidi, before you go, talk to me about this self-scheduling process that the acting health minister announced, please.
Yes, sure. And I think it's very important to give credit where it's due. We do understand that the departments of health and government are trying as much as possible to ramp up the vaccine rollout. We do know that over 6 million doses have been administered in total. Just over 2 million people in South Africa have been fully vaccinated, which is fantastic news. And now they are trying to ease and make the process of the electronic vaccination data system a whole lot easier. So we know it's now in 5 languages, which makes it easier for people who don't know how to use the portal in English. They can use it in the other 5 languages. And we do know that previously you would have to, once you register, you would have to wait for an SMS before you go to a vaccination site, or some people would just do a walk-in. But now you can actually schedule your vaccination dates yourself at the nearest vaccination site closest to you. Previously, we would see vaccinations being scheduled at very far venues or vaccination sites where people did not have access to, especially in rural and remote areas. Now we know that you can yourself schedule your vaccination date and the nearest vaccination site, or a vaccination site at your convenience. This is going to smooth out the process a whole lot more and take strain off some of the vaccination sites that are seeing an influx of people.
Heidi, you've been so on the story. We're going to call you the COVID Queen soon. But as our reporter who's been doing so much work on COVID recently, what is the situation like at Joburg hospitals? Are we still hearing those horror stories of people waiting for hours in the parking lot, waiting for ventilators and oxygen?
Annika, I must tell you that a very scary and horrifying stat is that almost 17,000 people are in hospital at the moment, private and public, due to COVID-19. This is an alarming stat, and even though we are seeing numbers coming down, we're not seeing the pressure on hospitals decreasing. And this is because it seems as though the Delta variant is a lot more vicious, it's a lot more transmissible, and it seems to be targeting people a lot more worse than what we saw with the Beta and the Alpha variants that dominated the first and the second wave. So it seems as though there's a lot more pressure. Of course, when you ask government what's the situation in hospitals, they say the situation is under control. But when the NICD releases its stats every day at 7 o'clock, and you look at that number that says 17,000 people are currently in hospital because of COVID-19, it does not paint a pretty or positive picture. And this is why people are advised to get the vaccine. You aren't forced to, but you're advised to get the vaccine because there's a very high chance that it will protect you from severe COVID-19 and hospitalization, as well as death due to COVID-19 complications. So that's the picture when it comes to hospitalizations because of COVID-19.
Thank you so much, Heidi Giokos, as always, for bringing us the latest news on COVID-19 in South Africa. And just to remind you there, 47,500 vaccines destroyed due to looting, but 6 million people have been vaccinated.